today. My name is Sam Tracy. I'm the director of the Connecticut Coalition to Regulate Marijuana. I know this is a really busy day today at the Capitol, so I appreciate you all coming out. We're here for three different reasons today. The most pressing of which is to support HB 5314, which has a public hearing in the Public Health Committee today. But we're also here to support the idea of marijuana regulation for adults more broadly. There have actually been 4 bills introduced in the legislature this year, all of the sponsors of which, or some of the lead sponsors of which are here today to speak on those. And finally, we're here to launch the Connecticut Coalition to Regulate Marijuana. So I'm going to start off with the coalition, which just goes by Regulate Connecticut for short. Our members are organizations and individuals who are committed to ending the failed policy of marijuana prohibition. We approach this issue from many different perspectives, but unite in calling for 4 main things. The first of which is the removal of penalties for adults who use marijuana responsibly or grow personal amounts in the privacy of their own homes. The second of which is protecting consumers and reducing the illicit market by regulating and taxing marijuana similarly to alcohol. The third of which is creating a new industry that provides job opportunities for all, including farmers, workers, and especially communities historically targeted by marijuana prohibition. And finally, including sensible regulations to protect the environment, public health and safety, and prevent youth marijuana use. So we're just starting to build this coalition we're launching today, but it does already include 12 organizations. This is from AIDS Connecticut and UFCW Local 371, all the way to Law Enforcement Action Partnership and UConn for Students for Sensible Drug Policy. We also have individual members, including physicians, lawyers, academics, the former mayor of Stratford, and the former chief of police of Plainfield. Since 63% of Connecticut voters support this policy, we're very confident that this coalition is only going to continue to grow. We're always accepting new members, and folks who are interested in joining can find out more and reach out to us at regulatect.org. So without further ado, I want to turn it over to some of the legislators and other speakers here today, beginning with Representative Melissa Zebrin, who's sponsoring the bill that's being heard today.
Thank you. So good morning, everyone. I'm very happy to be here this morning to talk about an issue that so many of our Connecticut residents have been really earning for the opportunity to be able to have that conversation in this building. And I want to thank my colleagues behind me, especially Representative Juan Candelaria, who has been pushing this rock uphill for a long time publicly. It's not an easy conversation, but as lawmakers, we have a responsibility to bring these kinds of issues to the forefront, make sure they're discussed and debated, that we can have a healthy debate with those who agree and disagree with our positions. Our bills are different, but I think the end result is the same, and I really hope that as this bill potentially moves forward, we can have those continuing conversations so we make sure that we have the most comprehensive policies that protect children and allow responsible adults over 21 to be able to possess and grow a small amount of marijuana in their own home. And I appreciate being here today. I'd like to ask my colleague on the Appropriations Committee and friend, Representative Walker, to come forward.
Thank you. Thank you. Thank you, Melissa, and thank you, everybody, for being here. As my colleague has said, we are talking about something that many states around this area, around the country, are looking at now. Good morning. I'm excited to be here, and I want to help launch this coalition that we're talking about. This is an issue that enjoys bipartisan support and support from all aspects of state Connecticut. Revenue economic development is important right now, as we all know, especially as we look at the budget that we have before us. We have to look at new industries and develop new industries that are going to help for jobs and for growth in the economy. This could potentially create $63 million in tax revenue in the first year of legalization and $104 million in second year. It could create jobs, up to 15,000 new jobs in agriculture, manufacturing, retail, and other fields that are potentially added to promote this. And we also have to look at the other aspect, the dirty part or the dark side of what has happened with marijuana. We have had a severe problem with incarceration with people. Just in 2012, 750,000 people have been incarcerated for touching or using marijuana. Account for half of the drug arrests in America today. 87% of possessions alone. This creates an unnecessary exposure to the criminal justice system when we are not looking at all of the aspects of what marijuana is. So prohibition of marijuana hasn't worked. It has been around for thousands of years. It is time that we treat it and we address it appropriately. It's time to legalize, regulate, control what is being dispensed out in the communities, control and make safe the process. And it's also time that we tax it. We put it up in the forefront and address it just like alcohol and tobacco. At this time, I'd like to turn it over to Representative Candelaria. It's right behind you.
Just to touch a little bit on another point of view, we're talking about a black market that's probably $350 million, and that's an understatement. If we don't regulate, we're actually subsidizing the drug lords who are trafficking drugs to our state. We need to act now. This is a sensible legislation. 63% of Connecticut voters support this measure. We need to start the discussion, so I want to thank the committee for bringing this forward, having the public hearing, and we need to move it forward. We cannot continue to subsidize, spend additional dollars on incarceration in our judicial system. Those are dollars that can be refocused in other areas. The fact is that the drugs, marijuana is in the state of Connecticut. That's a fact. Either if we don't realize it or not, they're here. And we have to deal with the situation. So we need to start regulating it. Thank you.
Thank you. My name is Josh Elliott. I've been a professional poker player, poker coach, real estate broker, and finance director for a political campaign. I graduated from law school in 2013 and became a non-practicing attorney. I opened my own business called the Common Bond Market in Shelton in 2014, and we're sneaking up on 3 years now, growing rapidly year after year with the same core staff that we started with. And last year I ran for state rep, knocking doors and making telephone calls every day for months on end for the opportunity to represent Hampton in the 88th District. And from beginning to end, I have intermittently and casually smoked marijuana. It is incredible how that sentence can brand somebody as a slacker or a loser, given how over half of the population has tried cannabis at some point in their life. I don't get high and go to work. I don't get high and drive. I get high when I come home and I feel like watching some TV. I do it socially with friends. It's not an escape for me. I do it the same way someone might have a drink after work or take a hike in the woods. It's reflective. If I were to start spouting off statistics about the safety of marijuana, the people who agree with me would continue to agree with me, and those who disagree would continue to disagree. That's why I'm not going to spend any time talking about statistics. Rather, I'm going to talk about the availability and confirmation bias. The availability bias is, according to Wikipedia, a mental shortcut that relies on immediate examples that come to a given person's mind when evaluating a specific topic, concept, method, or decision. When I think of marijuana, I think of the movies I've enjoyed a bit more when stoned, the flavors that pop when you eat food, the interesting conversations I have had with friends. When someone who believes that marijuana is inherently bad or evil, as a colleague of mine noted just a few weeks ago, they think of children who smoke and flunk out of school. They think of old stoners from the 70s who spent more time in the streets protesting than working a job, or liberals who are ruining our country. Opponents of legalization bring these images to their mind every time the topic comes up, and it brings denigration and dishonest conversation. Yes, marijuana can be an unhealthy escape hatch for some people, but so can alcohol, sugar, sex, or sleep. Nearly anything can be abused if used to excess. To try marijuana is to understand that there are simply worse dangers in this world, and when the government brandishes the law, punishing people who want to smoke, it lessens itself. When someone smokes for the first time and discovers it's not the evil that people say it is, the door opens to the notion of what else is the government being dishonest about, what other drugs are as innocuous as marijuana. Confirmation bias is, according again to Wikipedia, the tendency to interpret new evidence as confirmation of one's existing beliefs or theories. When I think of smoking cannabis with friends, I'm reminded about the relative harmlessness of the drug based off repeat experience. When an abolitionist hears a story about someone withering away their life to marijuana, they are reminded about the social ills that marijuana creates. Then, through anecdotal evidence, they attribute causality when there isn't even correlation. But what if we're both right? I'm willing to accept that there are people who abuse this drug, just as there are people who abuse coffee, painkillers, and fatty foods. I wonder if opponents of legalizing marijuana are willing to accept that there are people who don't abuse this drug. There's room for us to meet in the middle, and I'm willing to do that. It's time for our state to lead by example. We can be better. We can be honest. It's time to stop using marijuana as a tool to marginalize people. If there's abuse, let's address the underlying problem. But when there isn't, let's tax it and treat the sale and use like any other industry. It's time for us to be leaders. Thank you.
Good morning, everybody, and thank you all for being here. I am super duper excited to be a part of this coalition. Something near and dear to my heart for many reasons, and a lot of them have already been discussed this morning. But for me, it's about social justice and the impact that this prohibition on marijuana has had in communities that I represent, with people of color, brown and black people, and how we've gone to jail at disparate rates and just been treated, you know, in a way that is not fair. Nonviolent offenders, Representative Walker talked about how over half of the population going to prison is for, you know, this nonviolent offense. So let's talk about the money that we're spending on these prisons. And we're talking millions. And I'm not talking one or two. I'm talking 20, 30, 40 million dollars that we're putting into this industry. For what? I mean, there's better things that we could be doing with our money. We have a budget that we're looking at a $1.7 billion deficit. This is revenue that could be coming into the state. And that is important because of our fiscal condition right now. But what's more important to me is that we level the playing field, that we also talk about the jobs that will be in effect if we legalize. And I'm going to say when we legalize marijuana, because I believe that the time is now. You know, we played around with it. We got states around us looking to do this. And there's many reasons why we need to do this now. We can capitalize on tourism. We can look at the money and revenue that would come from that. And we can also educate people. Like Josh said, you know, there's a lot to be said about people that do smoke marijuana. I mean, they're productive. I know people personally, judges, police officers, friends of mine in these professions. They smoke marijuana and they're no less a citizen than you or I. So I do appreciate all of my legislators and colleagues being here to support us in this effort. I think that this is very critical. I think that it is for such a time as this. And I hope that we can count on the people and the citizens of Connecticut to come out and support us in this coalition, because that is how legislation gets moved in this building. We are one. I'm one of 151 in the House, but I represent over 20,000 people. And if there are my constituents out there that support this, I really need to hear from you. If you can't make the public hearing today or on the 22nd, I need for you to get on your computer, write some testimony, and get it into us so that we can move this ball forward. Thank you.
Good morning. I'm the Reverend Alexander Sharp. I'm not a legislator, but I'm proud to be here in support of these courageous legislators who are bringing this bill forward. I head a national group called Clergy for a New Drug Policy. We seek a health, not punishment response to the war on drugs and are mobilizing clergy nationally towards that end. I've been active in a number of states, most recently Maine, which has passed tax and regulation, in Rhode Island, where it's about to happen, Vermont, where it's close to happening. I'm delighted to be in Connecticut because I grew up here, I went to college here. In a way, this is coming home. Really a very short message, but I think an important one. Clergy seek the safety and health and the flourishing of all whom God loves, our families and our children, and we believe that regulation, labeling, testing, explaining a product is a way to make that product safe, combined with important education programs. The second reason that clergy are involved is because this takes the illicit marketplace out of the game. Why is that important? Because our kids are getting bad stuff. As we all know, criminals don't ask for IDs. It means that kids aren't getting stuff from people that want to sell them harder drugs. The third reason, and it's been implied here, is the notion that we're going to generate revenue, and that's important not just because of the revenue, but because it will enable education programs that bring the right kind of information, which doesn't happen in the twilight zone of decriminalization. So there are at least three major reasons why clergy support this. I love the phrase that we all have a moral obligation to be intelligent. This is an intelligent bill, it's a moral bill, and we're happy to lend our support.
Thank you so much. And I also want to take a moment to recognize all the other legislators who are here in attendance, and also to ask quickly, is Jim Myron in attendance? If you'd like to come up and say a few words. And never mind, but we also do just want to highlight some of the other coalition members we have. We have Jim Myron, who's the former mayor of Stratford, Robert Kaufman, the former chief of police in Plainfield, as well as Dr. David Bingham, a retired physician, and the list continues to grow. So again, thank you so much to everyone who made it out here today. Visit regulatect.org to learn more about the coalition, and stay tuned. Thank you. And we'd also like to provide the opportunity to have some questions if anyone has any today.
Sure. So what would you say to all the police chiefs that are out here waiting that are opposed to any legalization of marijuana? And also to Governor Malloy, who knows the state's budget issue very well, but still they're opposed.
On the side of policing, I would ask them to speak with law enforcement officers in many of the states that have already adopted these policies. We've seen in Seattle and Oregon, for example, that many of the police officers out there are actually seeing that this is improving relations with the communities, because in a lot of cases, unfortunately, the marijuana prohibition does cause a lot of strain, which makes it more difficult to have those positive relationships with your communities. And as far as the budget situation, I'd be happy to allow some of the other legislators to speak.
As far as the police are concerned, we would expect there would be opposition at first, because anytime we do initiate any type of new reform or change, it takes time for everybody to accept it. When we did different things in criminal justice system, we had opposition from the police department, but then when we worked with them, we went out and talked to the body. It became a process that we do together. It's not going to be overnight. It's going to take us time to actually look at the laws and work out the things that are necessary. We're not trying to say immediately, starting on June 30th, 2017, it's going to change. It's going to take time for us to go through all the laws and make sure that we address all the things necessary to make sure that we legalize marijuana use.
So on that note, this morning I was here early and I went and spoke to their lobbyist, Carol Hughes, and introduced myself to a half a dozen of those police chiefs. And what I said to them was, listen, this is an open conversation as this bill moves forward. This bill before you today only sets a date that to get information to the Regulation and Review Committee by October 1st, 2017. So this isn't, as Representative Walker said, hey, at the end of session we want to see legalization. We want to do it the right way, which means we have to engage with partners like our chiefs of police. On that note, I will tell you, though, there is new technology being developed in Colorado specifically, which is a saliva test. So there are some things that are on the horizon for research and things like that. As it relates to the budget, Representative Walker?
Well, as it relates to the budget, you know, everybody right now knows the pains that are coming out here. We've got so many things that we are going to have to eliminate without having any type of revenues, and people have said we cannot afford to justify it through taxes. We have to develop industries in Connecticut. We have to look at new areas for us to add and new job opportunities and opportunities for us to raise revenue to address education, to address higher education and communities around the state. So this, to me, is the best way for us to move forward in addressing that, with revenues of more than possibly $200 million that we could get after the first year of full implementation. I think that says a lot.
And this bill that has the public hearing today is very specific. It talks about a general fund to deal with those kinds of programmatic needs. I also am going to be adamant through this process that if there is surplus, that it goes into the budget reserve fund or the rainy day fund. We cannot continue to spend more money on programs without setting aside money for the rainy day fund. And if you notice that this bill says certain municipalities, because I want to make sure that municipalities who don't opt out, which they have certainly an opportunity to do, also have a little piece of that revenue, so that it's a multi-layered tax setup, and that's something that has to be developed with our partners after the October 1st deadline.
And I just wanted to add to that, we need to keep in mind as we reference the chiefs of police and police departments in general, that not just about revenues for the state. Let's talk about the jobs that people will get, the income tax, the role that we will be able to collect money from on that, the education piece. I mean, it's multi-pronged, and I think that, you know, change brings resistance, but in the end, change is good.
I'm a state representative, Edwin Vargas. I represent the city of Hartford here at the legislature, and I'd just like to address the issue. This issue goes back a number of years. Representative Juan Candelaria and I would first introduce this bill. I'd just like to address the question that was asked about the people outside who are concerned about this issue and oppose this issue. My heart goes out to those people, especially the ones that wrote heart-rending letters about what happened to their kids with heroin overdoses, how their lives were destroyed by the use of drugs. No one here is advocating the abuse of drugs. I want to make that very clear. I want to make very clear, one of the arguments from the other side has been that we're looking for blood money. I'd just like to say that right now, the money that goes to the illegal drug market is the blood money. When these criminal gangs gain the profits from the illegal drug market, they use it to buy guns, they use it to murder police officers, they use it to hire people as mules, they use it for illegal activities. So right now, drug profits, I believe, are the blood money. So if we regulate it as a state of Connecticut, and this is an issue that has hit my community hard, where many families have someone who's incarcerated because of the drug trade. We have to regulate this trade. Yes, revenue is important, but let's face the facts. There are people with addictive personalities. I remember friends when they were denied alcohol, they drank cologne. They were so desperate. There are people with addictive, that should be considered a public health issue. Addictive personalities have always existed, will always exist. We have to deal with them as a public. Criminalizing issues like this is not the solution. So let's get this bill passed. Thank you.
For Melissa and Representative Walker, question for you guys. Number one, it seems like all the controversial bills this year are going to start in the House. Number one.
Why would that be?
I know, right?
Because we're a lot better than this.
Personally, I like you guys better.
We don't have any senators.
First of all, so to that end, do you think that you can build a coalition of sorts in the Senate if this were to get out of the House? First question.
That's going to be a hard question. I mean, clearly there's been some statements made by folks in my caucus who are, I think have some very strong opinions. This is a bill that is going to lend itself to strong opinions. I remember my first year when I was on public health and we had the physician-assisted suicide bill. There's nobody who's mildly passive on this issue. So I really hope that by working together and having these kinds of conversations and letting them know that, listen, you have a concern, let's talk about it. Edibles is something that comes up often when I have these conversations. We need to make sure that we don't repeat the mistakes of Colorado, which is why I've been waiting to promote or propose a bill like mine. I started with the study of hemp. The next year I did research of hemp, and that's another thing too. You know, the federal government, there's been a bill proposed to end the prohibition of marijuana in Congress. President Trump on the campaign trail said that he was going to allow it to go to the states. Now there seems to be some backpedaling on that. We'll see what happens. And I think the more diverse faces that are willing to stand up and talk about marijuana, the better off it is for this state, our taxpayers. So I hope that my Senate colleagues watch this ever-changing, diverse group of folks who are willing to support something as controversial as this.
And secondly, you both mentioned you want to do this the right way. Waiting, get the study out there.
Absolutely.
Other states are already doing it. Maine's doing it. Massachusetts is doing it.
We're not saying study it. We're saying develop regulation.
Well, sure, but if we're going to be later to the game, then that revenue you're talking about for our deficits.
But rushing to the game does not make us successful. It's important. In Connecticut, we have to make sure that all the issues are addressed. Anytime you do something this major, even though we do have medical marijuana, so a lot of the foundation is there for the things that we do, and doing it through the consumer protection industry, it helps us to make sure that we set up the staffing that's going to also regulate. But we need to make sure that the police are involved, that the courts were involved, that all of the agencies that are going to be part of the production and everything have been established and all the people in place, because we don't want to do this, because as soon as we start it, it's going to go.
Well, look at what's happened in Massachusetts. They've said, okay, it's legal to own, but they don't have a process
Right.
yet. So they're saying it's legal for you to own it, but they can't go and buy it anywhere. So, you know, I don't think that's the best public policy either. So, you know, and I also think we need to make sure that we're competitive. So as we look at what's happening in Maine and Massachusetts and possibly Rhode Island, that we don't put ourselves in a place where we're not competitive. And I think that's another important issue that we have to really be deliberate about.
Thank you, everybody.
Thank you.